Hi, Rasha.
Hello, how are you?
I'm well. So good to see you today, and really looking forward for our discussion on maternal mental health, especially during the pandemic and the crisis that we
Yes,
are going through. So
yes.
hello everyone, and
Hello,
I
everyone.
really hope that you will find our video quite helpful and you will share it with many. Maternal mental health has always been something that is dear to my heart. I've been helping many pregnant women deliver with as less pain as possible, with as less anxieties or baby blues or postpartum depression as well. So, and Rasha has been also on board. And thank you for all your support, Rasha, always.
You're welcome.
So, I'd love people to get to know you. So let's introduce you to everyone. So Rasha is a registered nurse, and she works at the AUBMC department of delivery, right?
Delivery.
Would you like
Yes, labor
to
and
the
delivery.
labor and delivery, right? And she is also a breastfeeding specialist, and she's currently doing her master's in community and public health nursing at AUB. Correct, Rasha? Did I
Thank you.
forget
Thank you for the
anything?
introduction. Thank you for the introduction. I'm glad
Yeah.
that we're doing this meeting and talking about this important topic عن جد خصوصا بهيدا الأوضاع هلا. It's really important to raise awareness about mental health, maternal mental health, especially that pregnancy by itself, it's something that might يصير causes anxiety وخصوصا بهالأوضاع اللي هي already stressful.
That's so
Right.
true, Rasha. That's so true. So I'm very excited to see what will unfold during this lovely talk. So really what's happening now in the world and how it's affecting AUB and AUBMC. It's really hard to get your mind and heart around it, around what's been going on. So I really hope that it will be like a wake-up call for people to really go back to themselves, to really focus on what's important. And I'm very happy that now many people are, and many organizations actually, such as you and I as well, they're working so hard to decrease the stigma around mental health, and especially when women are pregnant. And you know very well, you witness this every day yourself. Hormonal fluctuations really cause a lot of stress on the pregnant lady and her partner and her family at large. So I really hope that we can now stop and look at our lives differently. When it comes to OBGYN in general, like obstetrics, gynecology, قديش مهم رشا يعني how important do you think that mental health needs to really find its place in the OBGYN model? How important do you think this is?
I think it's very important لأنه once بيكون في mental peace إذا بدك عند ال pregnant woman بيكون كل شيء smooth، حتى ال physical symptoms بيصيروا smoother، بيصيروا يعني كل شيء بيصير أهون و less painful إذا بدك. لأنه
والمانجمنت، حتى المانجمنت يعني بين حتى الدكتورز والنيرسز ومع البيشنت بتصير الكولابوريشن بيناتهم أسهل.
صح. ويعني بنصير حتى التعامل مع البيشنت بيصير يعني عارفين هن فهمانين نحن شو بيكون يعني المانجمنت صح.
Exactly, I agree. So in my practice, I launched, it's been many years actually that I launched the integrative OBGYN service. Whereas, you know, I'm there, I collaborate with the obstetrician, I collaborate with the nurses in the delivery suite. And this is when, you know, I got to know you more, not as
Yes,
like an
yes.
ex-student, but more as a colleague. And I was really proud and humbled to see you in action. And really, your compassion, your support, how you were present with your patient, our common patients that we had at that time, was really exemplary, Rasha. I will never forget
حتى
this beautiful experience, really, that we shared together.
وقتها إنه we saw the قد إيه it's important to have someone يعني from psychotherapy field
Correct.
to help these patients لأنه maybe now we are not enough in special cases to deal with anxiety, with mood disorders in pregnant women. We need to seek
Well,
help sometime
I agree. I
from
agree.
specialists.
So exactly. So definitely, you know, the OBGYN, the obstetricians that are really assessing and going through the birth plan with their patient. It's very important, you know, that they assess her mental health. It's very important to know if she's worried or not, if she is, for example, you know, having worrying from the birth, or if the birth will be quite painful. And you know, in the Arab region, there's a lot of misconceptions as well around birth, how it's traumatizing, and then you know, they would talk about how births are traumatizing, and this by
especially if it's
itself
the first baby.
exactly creates a lot of tension in the muscles, and sometimes it really impedes natural births, and we would then have to go ahead and do a C-section because of that. So
Or create preterm contractions. You know, they might deliver preterm.
A preterm, this is a very important point. So they might have, this would lead to a preterm delivery due to the contractions that are also again due to the stress that the lady has. So in here, I really hope that all the gynecologists and obstetricians that are also listening to also find it very important and serious to go into this integrative experience so that they can work hand in hand with psychotherapists. And sometimes they will also need to work hand in hand with psychiatrists as well, because sometimes there are panic attacks. The anxiety would be so severe to the extent that it would be causing a lot of panic attacks that are not really manageable, and sometimes not manageable by therapy alone. So in here, we will need to, the psychiatrist would need to prescribe specific medications that are given even when the lady is pregnant. So this would also make her life much easier, really, so that she moves on with her pregnancy and delivery without as well the risk of postpartum depression. So yes,
I wanted to ask, how can we know if this pregnant woman is having these symptoms of anxiety and mood disorders?
Yeah, actually, thank you for your question, Rasha. Usually when a pregnant lady is anxious and stressed, there are many, of course, mental, emotional symptoms that would be present, as well as physical. So usually, as you know, as well in your own training and the training of doctors, they would assess most of the time, you know, symptoms such as muscle tension, usually a lot of dizziness, a lot of nausea, and they would also sometimes do many tests, let's say, and the dizziness would have no organic cause. It would be just a symptom of the anxiety itself, as well as headaches, palpitations, many times gastric problems, you know, intestinal problems, a lot of bloating sometimes, or constipation or diarrhea, like irritable bowel syndrome as well, along with restlessness, sleep disturbances, and the susceptibility to pain really increases as well. Like I'm sure, like on your floor, sometimes when a patient is very anxious,
Yes,
even if you touch her or if you want to put an
she'll feel
IV, she would directly, for
freak out.
example, you know, no, or freak out, or don't touch me, or
Yes,
you know, she would really, you know, scream from the
feel
pain,
pain.
whereas an IV is not really quite painful.
Yes,
So those are
exactly.
the physical symptoms that are quite common, and the mental, emotional, of course, sometimes they would cry, they would have trouble understanding or comprehending when you are talking to them. They would not understand you or comprehend. Sometimes they will have problems with their memory, or they will tell you, you did not explain this, but for you, you would have maybe, of course, explained about the procedure the day before, or maybe in the morning, in the afternoon, there would no there would be amnesia. Definitely those are all signs of anxiety in pregnant
هل
women.
now you're saying the symptoms وهلا I'm remembering all the patients يعني
See?
الكل يعني
Yeah.
عندهم these symptoms and we يعني
And
misdiagnose or
sometimes you
yes,
misdiagnose, or you don't really
yes,
have
pay
the
attention to this.
mindfulness or pay attention that this is a lady who is really anxious, and sometimes you would be taking the vital signs and you would notice how her blood pressure is fluctuating,
Yes,
sometimes high
her
blood
heart
pressure,
rate.
her heart rate, maybe sometimes you'd see her hyperventilating or shortness of breath, or telling you انه افتحش بيبيك, or the temperature in the room, sometimes she is cold, sometimes she is hot. So all those fluctuations in temperature, Rasha, is also an indication of
Hormonal and
anxiety. Absolutely. So basically, definitely during pregnancy, we need to also mention that the cortisol level would be usually increased.
higher.
Right. So it's usually
The
higher.
stress
And
hormone.
yes, it's the stress hormone, which of course, if the lady is not really being provided with the emotional support that is necessary for her, this will lead to sometimes preeclampsia, right, Rasha?
صح صح.
Preeclampsia, sometimes, you know, intrauterine growth restriction for the baby, sometimes even, you know, problems with the placenta, or as we said, a difficult
Bleeding.
birth, bleeding, or a premature birth. So this is all connected to anxiety and to stress. And hence, this is why we are having this video today, especially when we saw how when we work together, really a great outcome presented itself.
Yes.
And it was really a difficult case, by the way. So I have the approval of the patient to discuss her case. Very difficult case, twins, a history of anxiety, right,
Precious
Rasha?
pregnancy. I was saying it was a precious pregnancy يعني.
Yes, absolutely. So the emotional support, how we integrated everything for her, how we really spent a lot of time teaching her what to expect, showing her as well what to expect in the NICU,
NICU.
after
Yes, the
the
NICU
birth.
helped a lot.
She's very thankful till this day. Like yesterday we were talking, and she's very thankful till this day for how we managed the things together, really. So supporting pregnant women to maintain resilience and to give them coping strategies, and we will be talking about coping strategies. This is very important in maternity care, and I really hope that well-being among pregnant women would be very much highlighted in the future. And you know, Rasha, I've always been as well interested, and I always tell my clients that
Yeah.
the mother's mental health really plays a huge factor on the infant's physical, on the baby's, infants, and physical health, mental health as well, the psychological development of the baby as well. And
Yes.
this is
The
really
bonding,
well
also the
recognized.
bonding between both of them, the mom
Absolutely.
and
The mom and the baby, you were saying about the bonding.
yes, the bonding, especially postpartum when she delivered. If she was anxious or depressed, she wouldn't bond with the baby like she's supposed to do. يعني ما بقى,
To
she
do,
won't be
and this
able
will
to
affect the
breastfeed. She won't be able.
psychological development.
Yes, of the baby later on, the behavior of the baby
Exactly.
later on
Even her milk supply will not
will
be
decrease.
will decrease a lot due to her stress. And you being a breastfeeding specialist, Rasha, how important it is for the woman to breastfeed her child, like for her psychologically and for her physically as well. Like breastfeeding has a lot of physical and
Yes,
emotional implications for the
for
woman.
both the
Can you
baby
tell us a bit
and the mother.
about that?
For
Yes.
Of course, for the mother, and it will increase her feeling of gratitude, of she will be feeling, proud of herself. She's doing this magic act, and the milk, it's a golden milk, the breastfeeding, the breast milk. It has a lot of benefits. It can decrease breast cancer and many other cancer in women. Mastitis and engorgement can be reduced بشكل مش
Yeah,
طبيعي if she can breastfeed. وهي حتحس إنه فخورة بحالها إذا she
that's
was
so
able to
true.
give هيدا الملك to her infant, وعارفة قد it's important للimmunity and the well-being of the infant.
That's so true. That's very true. And I always, talk about breastfeeding and how much it's important in those early stages, especially. And this definitely will pave the way for a better connection, stronger connection between the mother and her child for life, really, really.
True.
So far we've been really talking about how the integrative model provides better patient outcomes. And I've been also a lot into uterine cleansing, like helping the pregnant woman before she becomes pregnant, helping her really cleanse her uterine, cleanse her body, especially if she's been on an unhealthy diet before. So when she comes to me and she tells me, like when we talk about family planning, and she tells me I really want to get pregnant,
Yeah.
so we start from there. We start cleansing, we start working on the diet, we start working on the beliefs surrounding, pregnancy and delivery, and how, us as women, it's so natural for us to get pregnant and to give birth. This is something that we were built to do. And this by itself, people find to be very grounding and relieving. And of course, Rasha, I also use, as you know, hypnotherapy for labor and delivery. And also in terms of the IVF, as well, the IVF is very, very stressful. And of course,
It's a long journey.
It's a long journey, and sometimes it has a lot of disappointments because the IVF sometimes doesn't work from the first time. And this by itself programs the brain that it's hard to be pregnant, it's hard to deliver. So always providing the lady with a lot of support emotionally is very, very important. Of course, along the medical aspects of IVF by the gynecologist, of course.
OBGYN.
Yes, yes. So the emotional aspects are the responsibilities of the psychotherapist. So
which is a big chunk of the journey.
yes, and you know, we have a lot of infertility that is caused only by stress.
صح.
So no matter, you know, what she does and how many times she does as well an IVF, I've also had many cases where she's done everything she could, and except of course tackling the stress factor and whether she really trusts her husband to be a good father to the baby. And once we really focus on that and change the beliefs, and also sometimes do couple therapy so that they both feel they can trust each other with how they want to be parents and all that, and later on they get pregnant naturally, sometimes even without the help of IVF. So it's amazing how the mind and body connection really works with pregnancy as well. So Rasha, we are about, you know, to end our session. Yet before we end it, I'd really like us to talk about tips. So,
Yes.
so what do
Some
you
tips
think
to
are
prevent.
important tips?
So here's some tips to prevent and decrease this anxiety. First of all, we should know and we should talk about it. We shouldn't keep it
Yes.
ourselves. إنه ما لازم نخبي بقلبنا إنه this will increase the stress. You can talk to the support system. You can talk to your therapist if you want. And second tip is we can find a release, like you can do yoga if you إذا بيحبوا, or exercising, coloring. Find a hobby إنه يلاقوا فيه إنه الستريس هيك بيخف عنهم. They should go for it.
Sure. أنا دايما
Second,
بقول إنه أول شيء إنه you need to take care of yourself. You need to love yourself first. You need to put the oxygen face mask on yourself first, so that later on you can put it, you know, on your baby.
yes.
So, and as you were saying, of course, having the support system, you know, release in any way you like, be it through painting, certain movement, or certain classes that are specifically out there in our community for pregnant women, like Pilates.
Classes.
So yes, those classes are there in our community, and of course, get the sleep that you need. Make sure you are getting enough rest. It's very important. Make sure that your vitamins and supplements are quite optimized even before you give birth. Very important for your vitamin D to be quite high, because this is how your body would be creating your baby's bones, your baby's teeth. It's really from your vitamin D and calcium. You need your iron. So all of those, you need to make sure that your thyroid as well is balanced, because sometimes pregnant women might have thyroid problems, as well as your HbA1c, your sugar control as
level.
well has to be controlled. So all those things, they need to go hand in hand together. So it's like a full circle of mind and body and soul. Now for the soul part, meditation is important. If the person is religious, of course, to continue with the prayer or doing the meditation. There are many sessions that I facilitate to really connect to the baby, to communicate to the baby. So we always know, Rasha, right, that cells talk to cells. So, and the fetus, it's all of cells, right?
كله
so
interconnected.
كله interconnected, and we can truly talk to ourselves, to our body, to our baby, from the moment of conception, really, to prepare our body to trust our body, to trust our baby, to trust the process. It's really about trust. trusting your healthcare providers and trusting your body and your baby, quite important. And what else what else were you saying, Rasha, about the tips?
You almost said everything, but it's very important
Yeah,
to seek help. يعني the sooner you'll be
right.
able to gain peace of mind, of your health and the health of the growing baby. And finally, you can write about it. You can start a journal and
Yeah.
describe.
Very true. Like all those forms of self-empowerment are very important. Journaling is important. Joining a support group, for instance, at Wellbeing Center, I launched the Wellbeing Anchor. It's a group of women that meet on a weekly basis to discuss many matters related to women's health and to really give each other this empowerment from woman to woman. Exactly, because understanding, empathy, compassion are quite very important values. And when we are connected when we are connected and we share a beautiful relationship, and this really will make it quite
empower us.
easier. Exactly. So I really enjoyed talking to you, Rasha,
Same
today.
here. Me
And
too.
thank you.
Thank you, Elik, again for raising awareness about this important topic. عن جد, it's really needed here in our community and our culture.
Thank you, Rasha. I really, believe that always developing abilities. I believe we are born with many, many different abilities, all of us. يعني ما في حدا منا ما خلقان عنده gifts وعنده abilities. So I really hope that people will invest in their well-being more and more to discover those talents, those gifts, those abilities, and to really always be able to see the bigger picture. يعني مثل ما انت صار معك مثلا وقت بتكوني بالمستشفى, you are so focused on what you have to do to complete your tasks. واوقات في كتير اشياء بتكون عم بتصير بس الواحد قد ما بيكون راسه مبرمج هيك على الشيء اللي بده يعمله, بغض النظر عن الاشياء الثانيه. So
صح.
this is why it's
ويمكن
important
لما يحل
always.
هدول الاشياء simple things اللي هو ما بيكون شايفها, كل شيء بيرجع هيك بيصير
بيزبط أهين وبيزبط لوحده. Thank you really, Rasha,
Thank
for
you,
your
Elik,
wisdom again. And it's all about the collective efforts, the sense of community. Let's hope our video will be an inspiration to many people, to many different disciplines, and it will really help us move to places, to move forward to different places that really look good. And so much gratitude for you, Rasha, and we'll see you soon. Bye, Rasha.
Bye.
Bye, everybody.
Bye.